The forum really provides professional advice, networking and leadership for people working in that area of specialty. So in the Gastrointestinal Forum, we've got members from all areas of GI care. So you may be a stoma nurse, a colorectal nurse, endoscopy nurse, nurse working in nutrition or liver disease, and want to find and network people and share your practice and get guidance about your practice, and that's exactly what the forum provides. I think our really big achievements are our Facebook pages, which are really popular. So there's a Gastrointestinal Forum Facebook page, which is a closed page, but any member of the forum can join. And nurses really talking and sharing every day about stuff that's going on at work and clinical questions that they've got and experiences that they've had. And then we have a second Facebook page, which is a smaller one for nurses working with patients with inflammatory bowel disease, so people with Crohn's disease and ulcerative colitis. And it's great. It's a really good way of networking and sharing. Other really big successes, so we've got some great competencies for nurses working with people with liver disease. So whether you're working in virology or with alcohol or with patients when they're in hospital or transplantation, there are really good competencies that you can use to show your level of practice and work out what it is that you need to develop in terms of your appraisal and your annual performance. And then now we're just doing some work now about research, so supporting and developing nurses to research more and to lead more research, and also some stuff about education and what education is available for nurses in the area, because there's a real issue about access to education. We also represent members, so particularly for endoscopy nurses on the joint advisory group for endoscopy. So as plans are made about how services look nationally, we've got a really good strong voice on that for you. The big things that are coming up at the moment, the liver competencies we're turning into, working with public health to turn into a more electronically, more available way of you accessing them. We're redeveloping the iron deficiency guidelines for nurses looking after people with iron deficiency, and we work with other forums on that, so the Women's Health Forum, with renal nurses, heart failure nurses, lots of information about iron deficiency. And we're doing some stuff about career frameworks, so within inflammatory bowel disease, but also wider in gastroenterology, so writing to say how you can progress if you're working in GI care, how you can progress through your career. So our strategy really is three things. One is to really let members network, so you be able to share and support each other, and that's what the Facebook pages do really well. The second is to get good guidance out to you, so if there's things that you want guidance on, stuff that we can publish to help you know what the best practice is, then we can offer that. And then the third is just to represent GI nursing, so on committees, on NICE guidance, on national steering groups, we're your voice, so if there's things that you want us to say, that's what we're here for.